Months, Dr. Mallika Marshall has been answering all of our questions about coronavirus, and she's also a practicing physician on the front lines. And we wanted to ask her what she's seeing and her outlook for the weeks ahead.
I have been practicing medicine as an urgent care physician at MGH-Chelsea Urgent Care for almost 20 years. I consider it my medical home. Chelsea is one of the hotspots in Massachusetts, if not the #1 hotspot. It was for a while and probably still is. Those first few weeks during the pandemic, we didn't see a lot of activity, but I would say over the past 3 weeks, things have heated up pretty quickly. And so we're seeing a lot of patients coming in with COVID-related symptoms. The health center has sort of been turned into a COVID triage center. We are doing testing outside in a couple of tents. They've also set up a respiratory clinic on the second floor that really is completely dedicated to evaluating and testing people for coronavirus. I can't stop thinking of the patients who need oxygen but can't go to the emergency room by ambulance because they can't afford the ambulance bill. I can't stop thinking about the patients that I've seen who are afraid to go home even though they know they have coronavirus because they're afraid to infect their family members who have underlying medical conditions and could die from it. I have a hard time forgetting the people who are living in their cars to try to isolate themselves from their families because they have 6 other family members living in a studio apartment. These are the stories that keep me up at night. And these are the reasons that communities like Chelsea have been hit so hard by this virus. I'm hopeful that here in the Commonwealth, we seem to have flattened the curve. The hospitals have not been completely overwhelmed. It appears as though hospitalizations are going down. So we're heading in the right direction. But I'm fearful that if we loosen things up, loosen up restrictions too quickly, that our numbers are going to go right back up. And we're all going to suffer because of it. So as hard as it is to continue to stay at home, I think that we need to continue to follow the advice of the public health officials who really know what we need to do to try to get back to work. You know, in my 20 plus years of practicing medicine, obviously I've never seen anything like this. I have to say I've been very impressed, not only with how Mass General has handled the situation and the support they have provided us at the health center, but also in the resolve of my colleagues. I work with wonderful doctors and nurses, but not just clinicians. I work with support staff and the custodians and police and security, all of the people who work in our health center. It's really all hands on deck. Nobody has left, nobody has quit, nobody has said, I can't do this. I've been so heartened to see that the people that I work with are just like, hey, this is what we do. This is what we train for. This is what we've spent years learning how to do. And the time has come where we've got to dig deep and we just have to provide the best care we can.